Good morning, everybody. Dr. Anita here from Milan Family Chiropractic Center. You're riding in the car with the Chiro. So I thought we'd talk about today disc issues, chiropractic, pain management, and surgical intervention. When and why. So let's talk about the disc first, and we'll talk about the basic anatomy. Keep it really simple, and then we'll talk about the interventions that are needed and necessary at times, right? So your disc is like jelly in a jelly donut. When there's equal pressure on all of the donut portion, the jelly stays in the middle. Okay? That's good. When there's unequal pressure, meaning one side is compressed, it pushes the jelly towards the other side. When the jelly just pushes to the other side, but it doesn't tear any of the internal donut, those are called annular fibers. What happens is that's called a disc bulge. And that bulge takes up a little bit of the space where a nerve root comes out, and people get pains like sciatica or things shooting down your arm into your hand, down your butt into your leg, things like that. The next level of disc issue is disc herniation. What that is when the jelly in the donut starts to tear some of the donut fibers. They're called annular fibers. And it starts to rip through those fibers somewhat. And now that bulge has some of that jelly material leaning up against that nerve or nerve root, and wherever that nerve goes, you can have problems. So there's inflammation. It certainly will travel, numbness and tingling, and wherever that nerve goes, you can feel symptoms related to that numbness, tingling, pain, right? Then the next level of disc issue is where the disc becomes prolapsed, and that is where it actually tears through the donut walls, and that jelly still attached to the main part of the jelly is kind of hanging, but it's all still connected, and it's hanging in the space where your nerve root or your spinal cord is. That, of course, will increase the symptomatology of numbness, tingling, and pain wherever that nerve goes, whether it's down the butt into the legs or into your groin or down your arms into your hands or up into your head, things like that. And then the last disc issue is an extruded or a protruded disc, right? And when it becomes extruded, most importantly, that material that broke through the walls of the donut and got to the outside, it actually separated. So there's a piece of material that's no longer connected to all the jelly. And that's sitting there on the nerve and or on the spinal cord. So let's talk about what's appropriate for taking care of these things. So number one, when we talk about a disc bulge, chiropractic care is totally appropriate because there's undue pressure on one side of the disc versus the other. So we've got to balance that disc out. We got to balance that pressure out, and the body's an amazing machine, and it'll resorb that pressure so that there's equal pressure on the whole disc and no more pressure on the nerve root exiting in between the bones, and that will reduce and resolve the numbness, tingling, shooting pain, etc. When we get to the next level of a herniation, same thing. Chiropractic is most definitely appropriate, and the body can resorb that same issue. Occasionally, when there's herniation accompanied with severe degeneration, conservative chiropractic care is always the first approach. If there's a lingering symptomatology, it can be appropriate at times to get pain management intervention, which is typically not drug therapy orally, but possibly an epidural where they go in and inject a corticosteroid into where that nerve root is inflamed, and it will decrease the inflammation and help with reduction of the symptomatology. The next level is we did bulge, we did herniation, the protruding disc where it's dripping down. This also, chiropractic care can certainly help. I don't believe that the protruded disc is going to be suctioned back up into the center of the disc material. It may always be there. Good morning, Kevin. But the difference is conservative chiropractic care to allow the pressure to be equal on all portions of the disc. And of course, again, we talk about pain management and the potential for needing an epidural to reduce the inflammation because that disc material is sitting in there. There are times where it is so severe because of severe degenerative arthritis that they may have to go in and do surgical intervention to remove that part of the extruded disc. Always, always, always try conservative chiropractic care and possibly epidural before you consider a surgical intervention. That is last, always last. The last stage is where the disc is protruded and has extruded, meaning that material has dropped down and separated from the rest of the disc. And with an extruded disc, that's where that material is just sitting in there, whether it's next to the cord or whether it's next to the nerve root. And no amount of chiropractic care is going to remove that because that material is separated from that disc material. So that's where obviously a surgical consult is appropriate. And I'm not talking about major surgery where they go in and remove the whole disc and put nuts and bolts and cages in there. I'm talking about a microdiscectomy where they go in and they make a very, very tiny incision and they go in and suck out that little piece of extruded disc, and also use corticosteroids in that region. And then most importantly, follow up with conservative chiropractic care in all of those disc issues, with or without severe, mild, or moderate degenerative osteoarthritis, degenerative disc disease. Conservative chiropractic care is always and should always be a part of the care plan. The reason being is if you have degenerative or osteoarthritis in the spine, you go in and have surgical intervention, it's expected that the spine's going to continue to deteriorate because it's a progressive degenerative disease. And conservative chiropractic care will keep mobility in the joints so that the spine doesn't break down. So as a chiropractor, I'm not against pain management or surgical intervention when it's appropriate, but conservative chiropractic care should be always the first approach and the ending approach once you've done all the other approaches that were prudent and necessary, and follow up with the chiropractor so that your spine doesn't continue to break down. So this is Dr. Anita from Mylon Family Chiropractic Center right here in Bayville, and we're talking about disc issues and what methodology is appropriate. Chiropractic, pain management, surgical intervention, they all serve their purposes. And then, of course, ending again with chiropractic care to manage the spine so that your spine doesn't fail again. So take heed. If you know somebody who's suffering with symptomatology possibly related to disc or have been diagnosed with a disc issue, always, always, always choose conservative chiropractic care first and allow the chiropractor to decide and help you decide if conservative will work or not work so that you can be sent off to the appropriate other things that may be needed after chiropractic care or maybe before chiropractic care, and then follow up with chiropractic care. All right? So you have a wonderful day. I'll catch you on the next ride.